Hi, everyone. I'm Sarah Kruse, and I have my dear friend Gillian Ehrlich here with me today. I've known Gillian for so long, and we've been walking a parallel path with Ayurveda for many years. And we have the same beloved Ayurvedic teacher, Dr. Vasant Lad. And whenever Dr. Lad would come to Seattle to teach, we would always come together and delight in his teachings, delight being together as a community, have lunch with Dr. Lad and the other students. And I just feel so blessed to have these friendships and to know Gillian. And I'm just really excited to share what Gillian has been up to. She's been growing and building her practice in amazing ways over the years, but more recently, she's just opened a clinic called NeuroVeda Health. So Gillian is a nurse practitioner. She specializes in functional medicine and Ayurveda. Gillian, actually, could you share more with us about your degrees, what you
Yeah,
offer? Because it's so vast and wide.
yeah, absolutely. It's been a really circuitous path, and you and I really have known each other these last 20 some years. And so I'm happy to do that part of it. So my history is that I started out actually as an outward bound instructor doing outdoor education here in the Northwest. I was really interested in health. My childhood friend took me to a class with Dr. Ladd, and I think 98 or 99, healing psychological trauma. And that's where my mind was blown. And I was like, this has to be this is so interesting. And I use it with my outward bound students. And I found how much they changed and developed and how much I could teach to them specifically, as opposed to just teaching in general, how to anchor the boat, how to sail the boat, how to use the cook stove. And so I ended up going back and studying a year with Dr. Ladd. And that's where you and I met, somewhere along that way in 2000. And I then left feeling like that needed to be our base in our common foundation in Western medicine. So I went back for nursing school. I was a nurse at Harborview, which is our big inner city hospital here in Seattle, for 8 years. I went back for my nurse practitioner training. I continued my Ayurvedic studies. That's where I was introduced to functional medicine, which I was certified in 2014. I then worked taking care of homeless, I should say unhoused adults with acute medical needs, often substance use and mental health issues, at Harborview for another 4 years as a nurse practitioner. And then I also worked a little over 6 years buried in primary care at Swedish, which is one of our standard healthcare nonprofits in Seattle. And I was doing Ayurveda and functional medicine there. And in the end, I wasn't able to do everything that I wanted to do there. And so I shifted over with a neurologist friend of mine, Dr. Eileen Ruhoy, to Center for Healing Neurology, a private clinic she started in 2016. And then I took that clinic over in 2021, and we just rebranded as NeuroVeda Health. We are at 1818 Westlake Avenue in Seattle, and we offer medical visits for complex and chronic disease, for longevity, for performance, for oncology. We have a naturopath who has our master's in Ayurveda, Dr. Juliana Giles, who also specializes with oncology and cancer patients and cannabis use. We do ketamine-assisted psychotherapy for those rites of passage and transitions in life, and working on treatment-resistant depression or even suicidality. We also have an IV lounge. And so one of the things that's been really fun is everything we approach in Western medicine at NeuroVeda Health, we do with a foundation of Ayurveda. So just yesterday, actually, we had an MS patient in who, was a really active guy, liked to bike and kayak and climb and rappel and run and ski. And over 15 years, noticed that his left side was starting to lag, and is on Western medications for MS, but came to see us and had a day of rejuvenation yesterday, and reported to Jennifer LaValle, who's our director of Ayurvedic services, sitting in the steam box. He said, "Oh my God, my entire left side is quiet." Like the buzzing that happens, with the burning of MS, that burning piece had dissipated. It was quiet. And so it had been years since he'd felt that in his body. And just to say that Ayurveda is such an incredible therapy. And so we are so excited to offer it for everybody who wants to improve their brain power and their function, who feels like they want to age well, who has long COVID, who has vaccine injury, who has PANDAS or PANS, or pots or pans, postural orthostatic tachycardia syndromes, dysautonomias. PANDAS is pediatric acute onset neuropsychiatric disorders associated with strep. So just there's, lots of chronic immune inflammation driven neurodegenerative conditions that we're seeing in today's world with our modern life, with our pollution, with our light pollution, with the way that our minds are not held by nature or community like we evolved to do, hundreds of thousands of years ago as animals on the planet. And so our hope is really to offer this back to patients in this modern world. Sorry, that was a lot of.
I love it so much, Gillian. Well, that's where the magic lies, I feel, is in the integration of Ayurveda. And then, as we know, modern medicine has all these amazing tools, but when they're offered in the foundation of Ayurveda, like you were sharing what happened yesterday, these things start to happen sometimes immediately, and people see the results like, wow, tell me more about Ayurveda. What is this?
Yes.
And I feel like that is the wish of our teacher, Dr. Ladd, is that his students bring Ayurveda out into the world and integrate it with other systems of medicine. And I've been seeing you do that over the years so beautifully in Seattle, bringing Ayurveda into Swedish Medical Center and Harborview into your daily practice and exposing people to what it is. And I feel like that gives, so much possibility for true healing. It directs people back to understanding themselves and their true nature. And they get the best of both worlds. And just the sound of some of these therapies you're offering just sounds so cutting edge.
They're so fun. It's so fun to play with the physiology and play with the body and the mind. We have so much neuroplasticity that happens that, before 2015 or before 2010, a lot of neurologists were originally trained, in the last decades, that our neurons just sit and that they're static. But it's not just the neurons, it's all the synapses. And so it's the way that our neurons connect. And so it's not like necessarily the streets of the neighborhood change, but there's always remodeling that happens in the houses that are on that street. So there is a lot of room for change and for growth across the lifespan. And that is one of the things that Ayurveda says is our mind should be active and we should be growing, evolving, helping the universe, be helped by the universe until our last breath.
Absolutely. Wow. And some of these conditions that you mentioned, really, they're treatment. There are conditions that we think, are difficult to treat, or a lot of practitioners may not know how to start treating them, but you're taking them on, with your team of highly qualified practitioners. If you could just mention a few of those again, some of the treatments that you specialize in and some of the conditions you specialize in treating.
Absolutely. Absolutely. So in terms of conditions, a lot of what we see gets encapsulated under what we call the pentad. And so the pentad, the original pentad was the triad. So instead of 5, there were 3. So under the triad, it was hypermobility syndromes or hypermobile EDS, Ehlers-Danlos syndrome, mast cell activation syndrome, and dysautonomia, which is a disorder, a mismatch of the autonomic nervous system between the sympathetic and the parasympathetic. So your fight or flight and your rest and digest gets confused. And so you can be standing in line at the airport and suddenly your heart rate shoots up or your blood pressure drops, even though that's not what the situation, the context of your environment is calling for. It's a dysautonomia. The autonomic nervous system that governs the heart rate and the blood pressure gets confused. And what's interesting is that in Western medicine, it's either things are typically too high or too low, but Ayurveda really talks about this confusion of intelligence, this loss of intelligence. And that really is what is happening in a lot of dysautonomias. Sometimes it's too much, sometimes it's too little, but a lot of times it's not the right amount at the right time. It's that confusion. The mast cell activation really looks like allergies, food allergies, people who are allergic to the world, allergic to air, the people who get sensitive walking down the detergent aisle in the grocery store, people who get rashes on their skin very easily, or who eat food and then their nose runs, or they get rashes or hives. That can be a mast cell activation syndrome. And then the hypermobility syndromes can be problematic. Hypermobility in itself is not necessarily problematic, but if you've got hypermobile joints, sometimes you have hypermobile connective tissue on the inside. And it really is a lot of our connective tissue that not only holds our organs together, but that does a lot of our cellular signaling. So Ayurveda talks, I feel like as the more I've learned Ayurveda and the more that I've learned Western medicine, I'm realizing that Ayurveda talks a lot about how cellular signaling happens, how the communication happens. And it's kind of like the cells constantly like, I'm cool, you cool, I'm cool, you cool. And if this cellular communication isn't copacetic, then that drives inflammation. And when we have that chronic inflammation cycle, then the inflammation looks for a place to settle. And that's when we have disease. So that was the triad. And so on top of that, we add small fiber neuropathies, which can be numbness or tingling. The most common in the extremities, the most common small fiber neuropathy is actually from diabetes, diabetic neuropathy, but it can happen in other ways too. And so you can have a small fiber neuropathy that results in gastroparesis, which is when your gut motility really slows down. And if you think about it, if you're in a state of panic, your digestion doesn't really work very well, right? If you're hiding from a tiger, and you're, in the grasses hiding, then your gut stops, your cellular repair stops, your regeneration stops, your processing, your mental processing stops. And so every time we're afraid, be it a perceived threat or an actual threat, there's a lot of shifts that can happen in the body. And so gastroparesis is one of those things that can happen with a small fiber neuropathy. So that pentad is the hypermobility connective tissue syndromes, and that can also be stuff that happens in the neck called CCI, cervical cranial instability or tethered cord. And I won't talk about that because it's too much. But also that mast cell is part of innate immune dysfunction. You can have adaptive immune dysfunction, which are the B cells and the T cells, the immunoglobulins, and that can look like autoimmune disease or cancer. Autoimmune disease, I think 10 years ago, it was like 1 in 9 women have some level of autoimmune disease. And in Ayurveda, that really comes back to digestion. So we work a lot with that. So those are the types of patients that we're seeing. Long COVID is an easy one. Lyme disease, Epstein-Barr virus. And then the treatments that we use are diet, lifestyle, the mind, ketamine-assisted psychotherapy, this IV lounge where we've got mitochondrial IVs, we've got neuropeptides, we've got lots of different vitamins and nutrients, minerals, amino acids, glutathione, NAC, taurine, vitamin D, vitamin B, methionine and acetylcholine. So lots of different options for injections as well as for IV. Oh, methylene blue, which is a pretty fun one. Your pee turns blue for a couple of days. Looks like you're peeing a pina colada. NAD, nicotinamide, adenine dinucleotide. So there's just lots of options. So the IV, and then we still do breath work. I really always come back to the Ayurvedic therapies that are really cost effective in terms of breath work, body work, diet and lifestyle, learning your own constitution so that you can live best in the world.
So many different things that are offered. And yeah, that integrative approach, I think, is what gives people long-term success. And Gillian, you also offer panchakarma in your clinic, right?
We do offer panchakarma. So panchakarma, pancha meaning 5, karma meaning actions of detoxification. And so we offer day of rejuvenation, like a 3.5 hour little one. We offer 3 days. You can do 5 days. You can do 10 days. And our clinicians will work with you for the prep and to get all set up. And then you'll come to our clinic for however many days you're seeking. And we just carry you like in a little warm, oily, cozy nest of goodness through that process. Ayurveda so wisely recognizes that we can really only do deep change if we're really held and supported. So the cleanses that often people do, it's not like they're bad, or not necessarily bad if you're just like drinking shakes and you come off your regular diet for a week. But to do that really deep change, you really have to open those channels of communication. And that's what a lot of that body work and that oil can do, or internal oleation, external oleation. And so panchakarma, as popularized by, do you know who did panchakarma recently? So Kourtney Kardashian and Gwyneth Paltrow.
Oh, right.
I've had a couple patients come in lately and say, I want what that thing that they're doing. And I'm like, okay, stop. Yeah. And I'm like, oh my God, thank you, Kardashians. Thank you, Gwyneth.
It's so funny. And you're one of the only centers in Washington State offering panchakarma, as far as I know. Just a handful of places throughout the state are offering this. So it's really quite a gift for local residents of Seattle, or even if people want to come from out of town, they can stay and come and receive treatments from you.
Yes, absolutely. There's a hotel around the corner from us, about a half mile away, maybe it's a mile, but around the corner, that has kitchens, so that you can bring your food. We can help you navigate how to do that and how to maintain, just a really peaceful center while you're with us
Hmm.
in the heart of the city.
So I'm hearing that you focus on treating acute and chronic conditions, but really setting people up for long-term success with their health, like setting them on their way. If you could speak more about that, I'd like to hear kind of your vision of that.
Yeah, absolutely. So, I will say that when I started out, I was interested in like saving the planet. And then I realized that if I was going to kind of help the earth, I needed to help people have clear minds, because if we perceive things clearly, then we behave appropriately, we make good choices. And so that's what actually originally got me into an interest in wellness and health and medicine. And so the idea is that the treatments that we do in our clinic are not things that you become dependent on us for. I do prescribe medications, that require ongoing refills, and I prescribe all sorts of medications for all sorts of conditions, even, antibiotics for pink eye or a UTI, even regular primary care complaints. We do I prescribe medications, and I refer for imaging and refer to specialty and refer for physical therapy and occupational, all those things. So I am like a pretty standard clinician in some respects, but I really do believe that whatever hardship we have is the place from which we launch. And so our goal, the Ayurvedic goal of life, is to continue growing and understanding yourself and your environment and your world. And for that, we need a capable body and a clear mind, to whatever degree that is possible. And so my hope is that, you come to our clinic and you see us, and then you kind of like move on with everything that you've learned. And I've had many patients over the last, 12 years, 13 years that I've been in practice now as a nurse practitioner, who will go away for years and years at a time and then come back and say, okay, I had another blip. My gut issues didn't come back, but my skin issues did. So let's work on that. And then we kind of work on that for a while and get a tune up and get back on track. The goal is not that you need me forever, but that you learn how to be your own doctor.
Yes, absolutely, Gillian. So how can people start working with you? What's the first step in contacting your clinic and getting started with service?
So there's so many ways, so many points of entry, and it depends on what level of time you have, what level of curiosity you have. On our website, neurovedahealth.com, people can hit the inquiry button, and then you can kind of say what you're interested in, and then we'll give you a call back and help route you the right direction. If you're looking to just come in for treatments, you can actually book now on our mindbodyonline.com site for NeuroVeda Health, and you can book there for an IV therapy. We're actually having a special here if you're listening before February 28th, 2023. So we're recording this in mid-January. But until that time, you can do a $99 first time in our IV lounge IV drip. And there's a couple specific drips that we're offering. So you can sign up just for an IV therapy. You can sign up just for Ayurvedic treatments or therapies. You can come right for Ayurveda with Jennifer LaValle or Dr. Juliana Giles, or you can come see me for like a full unfolding. Like we go through it. So it's 90 minutes, new patient visit with me, 90 minutes. And I start with where were you born, and were you born vaginally or C-section, and were you breastfed? Because I want to know how your gut microbiome was set from the very beginning. So we go soup to nuts, A to Z.
Yeah, and it's just so rare to hear of doctors offering the initial session at 90 minutes. You hardly ever hear of that these days. So That's incredible, Gillian.
Thank you.
I'm really fascinated by the IV drip. Who is that for? Like, who should come in for IV drip?
So IV therapy, there's a couple of things, so I'll say that IV therapies I really like, because what we know from Ayurveda is that we're not what we eat, we are what we digest. And so many of us have gut issues, constipation, diarrhea, gas and bloating, too much appetite, not enough appetite, too many cravings, so much sugar. Our gut is just not always in top shape. And so IV nutrients go right into a needle into your arm. And so you get 100% bioavailability of the nutrients themselves, but also you get them right to the cell's door. So they're already in their pre-digested form and they go right into your bloodstream. And so this is we've got a whole variety of types of IV therapies. You can try individual recipes or individual nutrients, like alpha lipoic acid can be really helpful for that small fiber neuropathy and for those peripheral nerves. You can try a blend of ours, some of our custom blends, like our Mito Love, which is for mitochondrial support, which is how we make our energy. You can do anti-aging, which is that methylene blue plus NAD plus glutathione. You can do performance for muscle building. So if you are just getting up off the couch and you're like, okay, I've got to do it. It's time. The pandemic has taken my life to this couch and now I must take it back out into the world. So that's the different types of B12 and branched chain amino acids. And then we've got what we call our NeuroLove, which is really for the nervous system and the brain health with the neuropeptides. And we've got ImmunoLove. So I have a lot of patients who come in either with an acute viral illness, be it COVID, be it shingles. Shingles can be really hard and result in post-herpetic lesions, things that, bother people for years. And so higher dose vitamin C and some of the nutrients that we give can kind of help clear the decks and make the pain. I've had patients where their pain has literally stepped down every time they've had an IV. And we have patients who come for just the mental clarity and the energy. So
yeah, so many of my clients these days, one of their top wishes is to have more energy. They come to me saying, I just need more energy. I don't have the energy I had in my 20s. What can I do? And it's the middle of winter. Yes. And as we know, there's so many approaches to that. But what a nice thing to come in and get an IV or 2 or 3 over a week and get that boost during the middle of the season, get that lift and energy and kind of that spark.
Yep. And patients do really leave feeling better. It always makes me so happy. We had a patient in yesterday who is active, healthy, in his mid-30s, exercises a ton, and was like, gosh, in the middle of that Mito Love IV, like I could feel it. I was like, oh, the engine's going. So
the sound of that Mito Love, I'm fascinated. I want to come experience that.
Come on in.
Gillian, so I want to circle back to Ayurveda for a moment and just hear from you, what you love about Ayurveda. You've touched on it a bit in our conversation, but what do you really love about Ayurveda?
I love that Ayurveda feels so humane. There's a way in which I think medicine and our society hands us our value, labels us as daughters, as wives, as husbands, as sisters, as whatever. We get this label, and then it's like we work in that role, and then it's like your life goes by, and then what is it? And health is kind of like you go to the doctor so that you can have something that gets you back on track, by suppressing your symptoms usually. And so I really feel like, and I use a lot of Western medicine, but a lot of it is symptom suppression. Some of it is treatment like a UTI or, an acute infection, or if you're in a car accident, Western medicine is the right thing. You don't want Ayurveda, you don't want Reiki for a femur fracture. I mean, eventually Reiki for a femur fracture, but you first have to stabilize and transport. And we use a ton of surgery and other procedures. I mean, I don't do them in clinic, but I refer for them. But Ayurveda has that underlying, what is it all for piece? Mm-hmm. And we really need our capable body and our clear mind to have a full life, to be able to sap the most of this juice out of this life, out of this incarnation in our body. Ayurveda is the medicine, is the system that recognizes that. And I recognize also, I just want to speak to, you mentioned our teacher, Dr. Vasant Lad, who we both adore to no end. And I just want to recognize there is a lot to say about cultural appropriation, and that we are 2 Caucasian women talking about how great Ayurveda is from India. And I have struggled with this over the last 20 years. Sorry about that noise. I've struggled with that over the last 20 years, but I just want to say that I do feel like it was a mandate that was given to us by Dr. Lad himself to please spread the word about Ayurveda. And so I love talking about Ayurveda. The difference that Ayurveda has made in my life has been tremendous. And it started with Anisha Derve. After years of having insomnia, she was like, rub your feet with oil before you go to bed. And I was like, that's the silliest thing I've ever heard. And I finally one night was like, well, I'm just laying here. I may as well try it. And I literally rubbed my feet and was like, oh my God, I'm falling asleep. And I was like, okay, what is this?
That's where it all started.
And that's where it all started. So I love Ayurveda for what it's given me in my life, not only for being able to manage my everyday moments, but also to manage my rites of passage over time and where I think I'm headed and what I think I'm doing. It allows me to be compassionate with myself for when I eat too much ice cream at night, which is not the right thing to do from an Ayurvedic perspective. But I recognize that, sometimes that just happens. And so it's okay. There's no, the shame is worse than the action. We shouldn't hurt ourselves twice. And so recognizing if I'm craving, like I woke up at 1 this morning and was like, oh my God, I want cereal, a cold milk cereal. And just recognizing, okay, what is that telling me? That's telling me something. It's giving me good information. It's not because I'm bad. It's not because I'm wrong. It's not because I'm dumb. It's because there's something going on. And what is that that's going on? And how can I address that underlying thing? And that's what I love sharing with patients, just taking out the shame and looking at what is. And what is that we are a pillar of light and a beautiful body, be it filled with pain and heartache, be it filled with, what we perceive as goodness. Ayurveda goes beyond goodness and badness. We just are. We are worthy we are worthy because we take breath. We're part of the universe. We're animals on the planet. We deserve to be here. And so we should have a good time and we should do this well.
Mm-mm. Wow. Yes.
So that's why I love Ayurveda.
Yes, absolutely. And I'm just kind of speechless. Yeah. And just, that part of how Ayurveda, has us have compassion for ourselves. This is one thing that I love so much about it as well, is the more we get to know ourselves through the lens of Ayurveda, we have less judgment and criticism and more understanding and compassion toward ourselves and then toward others, our family members, our friends, our bosses, these kind of things like, oh, it's their pitta. That's what's going on, And so that compassion part, I think, is really like, that's what drew me to Ayurveda as well, is like that acceptance, of oneself and of others. And I've heard you mention something a few times in our conversation, how, moving toward quieting the mind, that's one of your motivations for doing what you do, is helping people go in that direction. And I find that when we can quiet the mind and get still, then that clarity is all pervasive. And then we know what to do, with our next step in our lives. We can get clear about our passion, our purpose, our dharma, what we're here to really do. And there's so much noise in our world. And I find that coming back to these basic practices that Ayurveda and yoga and other wisdom traditions teach help us to kind of quiet that mind and get clear and just have appreciation and acceptance for oneself ultimately.
Oh, I love that. I mean, and that's what it feels like hanging out with Ayurvedic people. That's what it feels like hanging out with you, which is why I love it. And I remember like our last Sangha before the pandemic in 2019, we have periodic Sanghas get-togethers in Seattle. And I remember the first like 8 people that showed up all brought dessert. And I just remember like, these are not people. Like life should have a sweetness to it. It should be fun. It should feel good. It should be funny.
Absolutely. In fact, Dr. Ladd looked at my astrology chart one time and he told me one of my duties in this life is to feed people sweets, to share sweetness of life. Like it doesn't have to all be hard and challenging. We can actually share sweetness with each other in different ways.
That is very true. I mean, your food, Sarah, is like out of this world.
So well, it's time for another potluck.
I know, let's do it. For those of you also out there, I know if you're watching this, you probably know Sarah Kruse, but I want to put a plug in for your practice and for your skill set, which is really dynamite. Your level of clarity and your patience and your compassion and are really unmirrored, are really unsurpassed, Sarah. You're an incredible person. And you've been this way consistently since the day I met you. It included when you were the doula, when our son was born 8 years ago. I say that it was you that allowed me to deliver him. Like the advice that you gave me in that moment was like, oh, I do need to do this.
That was such a blessed day in my life as well, Gillian.
Thank you.
Well, I'm enjoying this conversation so much and definitely look forward to sitting with you in person sooner than later and going further. And when I have these kind of conversations with practitioners, I often will ask what's next, but it sounds like you're living it. Like these things you've been moving toward are happening in the present. But still, is there anything you want to share about what you're doing now or what you're moving toward?
It's a good question. And we are constantly kind of changing and adjusting, just like you do in the life. You wake up in the morning, you see what the weather is, you think about what the season is, you think about what is the clothing that's appropriate for today. And there are anchors in the life, right? So I always scrape my tongue. I always brush my teeth. I always wash my face. I always put on your face cream, your rose face cream. It's so handy. You're right here. Um, so there are ways that we have anchors, and I think Ayurveda and functional medicine and conventional medicine and doing tilt table testing, autonomic testing, and continuing to learn about medicine, these are the anchors. But how we present it and our offerings for folks are what are going to continue to change based on what the need is in our community and for patients. So for example, right now we are offering remote services for diet and lifestyle consultations, for breathwork training, as well as we have a super cute little mini consult where you can come for 30 minutes, remote or in person, and then our clinicians will make up for you a personalized, customized essential oil blend for you in that moment according to your constitution, or you can choose to have a spice blend. So they'll mix the spices right then and there, or if you're doing this remote, we ship them right away in the mail. But it's a way that you can kind of have a mini consult, walk away with a product that you can use in your life and understand a little bit about your Ayurvedic constitution. And so those are the kinds of services that I'm excited about in terms of offering people this little window into Ayurveda that we hope just grows and grows and grows and grows.
Wow, a personalized essential oil blend or spice blend. It's so tactile and people can really get right into it and enjoy. I love that.
Yeah. So fun.
Well, Gillian, you're such a blessing to humanity. I'm just so honored to know you and share you with the world. And as we're closing, I just want to give you a chance to share any final words of wisdom or any aha moments you've had lately or things you've been thinking about that you want to share with us.
I think aha moments. I mean, I would just say I'm so grateful for the people in my life and, the challenges that we all go through. I will share, my mom passed away in November of 2021 from a brain aneurysm, sudden, totally unexpected, like exercised, went to dinner with my dad on her last day. And so I think that all of us experience things that devastate us that really are rites of passage, whether we want them or not. And I just want to say that, we can't always be in charge of what happens to us or what happens in our lives. But we do want to use whatever that befalls us as a place from which we launch. And so a lot of my current incarnation of my practice, I think from the outside, it seems like it's so great and it's so easy and it's so simple and it's so fun. And I've talked about that as a way of practicing Ayurveda, which I do think is true. But a lot of this was born out of, my grief of losing my mom so suddenly and feeling like I have to make this grief worthwhile. I have to do something. I have to do something around that. And so this practice really is, in some ways, like a love commitment to my mom.
Wow. It's so profound, Gillian. Yeah.
Sarah.
What an honoring of your mom and her legacy. Yeah. And you're continuing to live that and in your everyday service to the world.
Yeah.
And your love of people.
Yeah, I do love people.
Oh, Gillian, thank you for sharing so many gems of wisdom and heartfulness. And I'm going to be thinking about a lot of things you mentioned the rest of the day and looking up some of these therapies. I'm fascinated to learn more.
Oh, come on in. Come on in. Happy to meet you.
Great to see you today, Gillian.
Thank you so much, Sarah.
Thank you.
Thank you.
Bye.